Every day I wake up and I feel like some of my life, my liberty, or my pursuit of my happiness is being sucked out of my body. And I'm getting tired of it. Thank you.
This bill came, like I said, came to my committee. We had 51 amendments. I had 7. Not a single one of them were passed. One of those amendments was to add tort reform to this bill, and that was rejected. It's something that the president has said will not be in the final version of legislation.
I think you're naive when you listen to what the Democrats are telling you. I don't think your bill is going to see the light of day because they don't talk to Republicans.
Pretending it will. I've been told my bill won't see the light of day by the chairman of my committee.
When Senator Arlen Specter was asked by a citizen if they crammed down a single page down our throats, would you accept it? And his reply was, well, I'd have to take that under consideration. Which leads me to believe that Washington is full of elitists and people that are look down on us in a condescending way, and they think we're stupid. I'm fed up with them.
Put you down as a no as well, then, I guess. We in Congress better be in it as well. I agree with that. It's a moral authority issue. Yeah, everybody. Unfortunately, that amendment was defeated, and a similar amendment's been defeated everywhere else.
We in America believe that everyone deserves a public education, right? Why would we not believe that everyone deserves health care? According to, thank you, I don't think it's asking too much to have millionaires pay an extra 1% or 2% or 5%, especially because they have all the loopholes and I don't. Thank you.
You bet. All right.
Tax the rich again? I've never gotten a job from a poor person. Tort reform.
To me, this is all about control. This is just another example. Healthcare is all about control.
I believe you can have universal health insurance in America. You can have it for everybody, regardless of pre-existing conditions, without having the government take it over, without having this kind of a system.
The United States spends 15–16% of its gross domestic product on health care. These other industrialized countries with their nationalized health care systems are spending 10%. In effect, our current health care system, primarily those insurance companies, are nothing but a 5% anchor dragging down the United States and making us less competitive. So why not go to a nationalized health care system? I don't care if they ration, because rationing happens in private insurance. No private insurance company is going to pay for a transplant for a 90-year-old. So I would rather have the rationing done by people who we can steer with our votes rather than an anonymous insurance company.
Hey. Come on. It's been going pretty well so far. I can't read it. I don't have my glasses. Peace. Yeah, gotcha. Town hall peace. That's good. I like that. I want transparency on what things cost when we go buy health care, on everything we buy. And I want transparency in quality metrics, standardized metrics on price and quality, so we can shop for value. And I want the patient to have more power. You've got to regulate insurance. Okay, wow, I'm a Republican. I just said that. Yeah, you have to. I mean, you have to have the right kinds of regulations in place of insurance. And to me, where the subsidies ought to go are to those with pre-existing conditions, those who get sick, to kick in to help them afford their care when their care gets really expensive. Got to make insurers don't get away with dropping people, don't get away with shortchanging these kinds of things. And let's have a system where there's more competition, not less. Let's have a competition. Let's have a system where the doctor, the hospital, and the insurance company compete against each other for our business, for our rights, so we can choose and walk with our feet. Where the constitutionality of this will come due, where scholars have been telling Congress, is when you have the government inserting itself in the provision of health care. When a rationing decision occurs, whereby a government agency determines what a doctor can and cannot prescribe, what will be paid for, what will not be paid for, in order to extend a person's life, that is where the constitutionality of this comes into question. And it will only occur until after this would have been in law, this would have occurred, and someone then would have filed suit against the government based upon their rights under the Constitution, that this would be unconstitutional.